Hello everyone, welcome to my channel Squad Scrub. Today I'm gonna start the topic. This is my first video which I'm recording. I'm recording my videos mainly for the FMG students. I'm also FMG student for now, studying in 4th year. So my content would be for FMG students, and also Indian graduates also can watch this, undergraduates. So I would start this topic from basics of topoanatomy. In this topic, I would take topographical anatomy, its terminology, methods of research in topographical anatomy, different forms, surgical operations, how it is done, what are the criteria, what are the surgical instruments. All this would be covered in this video. So first it would be the terminology. In the terminology, there are three types. First one is the holotype, syntopy, skeletotopy. Now what is the holotype? Holotype is the projection of the organs and anatomical formations on the surface of the body in corresponding region. Hollow means what? Hollow means whole. Topy, it's a structure, whole structure of the organs and anatomical formations. Syntopy is the interrelation of the anatomical formations with one another. And skeletotopy is the interrelations of the organ with the skeleton. It is called skeletotopy. Holotopy is the whole organ, whole body relation corresponding with the whole region. Second is the syntopy, which is the anatomical formations with one another, and skeletotopy is the relation with the skeleton. Now these three terminologies are important. The second is the methods of research in the topographical anatomy. This is just a brief introduction, like how does it work. Now there are two types of topographical anatomy, which one is on the live subject and one on the cadaver. On live subject, everyone know. We almost go through random test and all, like anthropometry, X-ray diagnostics, computer tomography, angiography, scintigraphy, thermography, and MRI. And on cadaver, what we do, which we are going to study during the anatomical structures, which is dissection, sawing of frozen corpse, sculpture, injection, corrosion, histological methods, electron microscope, and experimental methods. Now there are two different types of body forms. Actually there are three, but in consideration there are two. One is brachiomorphic build and second is dockleomorphic build. What is brachiomorphic build? In this, the structures of the organ structures, the position of it differs. On the brachiomorphic, the diaphragm, the transverse position of the heart, the oblique high position of the stomach, and the wide extraperitoneal fields of the liver are at the high position of the cecum. And in the dockleomorphic build, all the structures are at the low position of the cecum. The consideration is taken from the cecum. Okay, it is differentiated from the position of the cecum. If all the structures like diaphragm, transverse position of the heart, oblique heart, high position of the stomach, wide extraperitoneal field of the liver, all these are high position of the cecum. And in dockleomorphic, it is a low position of the cecum. It is a different forms of body builds. Now next, it is a main terminology of the operations. Okay, terminology of operations. How it is called, how it is termed. Now, we say amputation. Okay, what does it mean? Amputation means removal of the peripheral part of the organ, such as amputation of the limbs. We usually say that the patient amputated its limb, lower limb, upper limb. What does it mean? Removal of the peripheral part of the organ. Anastomy. What is anastomy? Creation of the artificial connection between the lumen of two organs, such as gastroenterostomy. Example is gastroenterostomy. Centesis. We always see while studying, we did thoracocentesis. What is thoracocentesis? Puncturing or piercing a surface. Ectomy. Now ectomy is completely removal of an organ. pulmonectomy. Implantatio means implantation. This term is very regular. It is nothing new for usual student. Insertion of an artificial organ or a tissue into the body. Implantation. We did intrauterine device implantation or any IUCD implantation, implant under the skin. These are all the examples of implantation. PECC. What is this? Surgical fixation of an organ to another one, such as nephropexy. This might be new to you, so please remember this. Pexy is surgical fixation of an organ to another one. Now next term is tomy. It is very common. Anatomy, laparotomy, incision of an organ's wall. Anatomy is the study of a structure when we cut. So in that consideration, incision of an organ wall is called as laparotomy. Now next is plasty. Formation of a plastic repair of an organ or a tissue. We always see in general life, we say there is a plastic surgery, skin plasty. All this, what does it mean? Formation or plastic repair. There is a reparation of what? Organ or a tissue, such as pyloroplasty. Next is stomy. What is stomy? Enterostomy. What does it mean? Creation of an artificial connection between organ or an organ with the environment. Okay. Creation of an artificial connection between organs or an organ with the environment. Next is the resection. Resection is removal of a part of an organ, such as resection of the liver. Resection means removal of a part of an organ. Removal of a part of an organ is called as resection, not whole organ, part of organ. Okay. Raphe. Raphe is stitching of an organ, wall or tissue. What does it mean? Stitching of an organ's wall or tissue is myoraphe. And the last is transplantatio. What does it mean? It is the commonest thing. Transplantation of the kidney means organ or tissue transfer from a man or liver to another man. Okay. Now all this terminology is important. So you need to remember all these things so you won't get confused when it would come in the general study on the regular basis. Okay. Now we move on to our next section. Operative surgery. Now from here, we would understand what is the main motto of studying this topic. Why we should correlate always this surgery and anatomy. That's why it is called as topoanatomy. In topoanatomy, we will study not only the anatomical structure or the topography of it, but in the relation to that, we would study the surgical operations with it. Because whenever we are performing as a future doctor, whenever we will perform surgery, we should know what is the anatomy, what is the location, because it might cause a blunder in future if we don't know proper location of it. So operative surgery is a medical science about techniques, methods and rules of performing operations and usage of the surgical instruments. Now, there are 3 stages of surgical operations. First stage is operative access, second stage is operative maneuver, and third stage is way out of the operation. Now, what does it mean? Operative access means what? Okay. Now, we would take the classification of surgical operations. Okay. By duration. First is the by duration. Why we should study this? Because when the patient is coming, we should know what is the immediate need. What should we treat? Is it urgent or we could wait, or what should be done next? So duration is very important. If it is urgent operation, then we should perform within 1 to 5 hours. Okay. If it is urgent operation, then we should perform within 1 to 5 hours. This operation must be performed immediately because it is a life-threatening condition. For instance, like if there is traumatic amputation of the limb due to any accident or any infection, operations of gastrointestinal bleed or gastric perforation. So this patient is very urgent and it should perform within 1 to 5 hours. Next is emergency. What does it mean? Which operation which we could postpone for 1 to 3 days. Okay, we can postpone for 1 to 3 days. This time is used for operative preparation. Now this 1 to 3 days, the patient is treated, but this time period is used for pre-operative preparation. Like for instance, amputation of the lower limb due to diabetic angiopathy, or if the conservation treatment is ineffective and the patient needs to be operated. Now next is planned operation. This operations is performed in the case of ineffective conservation treatment like acute inflammation. Okay, acute inflammatory disease such as acute cholecystitis. So this operation may be planned, so it would take time. And elective operations are which do not have specific time and it can be performed at any time. For example, like herniatomy and plastic operations. Now, next is by recovering. How do we know? There are two: radial operation and palliative operation. Radial operation gives complete recovery. Radical operations means complete recovery. And palliative operations do not give complete recovery but improve the patient's condition, like colostomy due to tumor of large intestine, which is obviously metastatic. Now next is by stages. Now there are three kind of stages: first, second and third. Now first stage, it is used to eradicate the illness. For eradication, okay, such as cholecystomy. Second stage operations are performed when the patient condition does not allow, or other reasons like to prevent remove the pathology at once. For example, adenoma. Okay. Now the third stage. It is always performed in the like issues, conditions, pathology regarding large intestine. Like for example, tumor of the large intestine, small intestine, tumor of small intestine. Okay. Now all these three stages are different. Okay. These three stages, in the third stage, we can proper planning and negotiation about 2 weeks after the inflammation, like anastomosis 6 months later or 1 year later. All these conditions are seen and then did. But first stage, we need to eradicate all the things. Illness, whatever the illness is, we need to eradicate in the first stage. Now second is appearance of blood. The operation is with blood or without blood. This operative involves cutting of the tissue. Now with blood, obviously the tissue is damaged, cutting of the tissue. By surgical instruments, like if any organ is removed, what is it called? Tomy, appendectomy. Without blood, this operation conducts, which causes superficial injury to the skin, or if there is any bone fracture or joint dislocation. So this is also without bloodless operations. Next is by size, minor and major. which is performed on the small area without an invasion of blood cavity, such as dissection. Okay. And second is measure, which is performed in the big areas with an invasion of the body cavities, such as resection of the stomach. It by size it is very common, like minor major, that's it. And by aim, it is curatives, diagnostic or cosmetic. Now curative example is cholecystectomy. Diagnostic is laparotomy. And cosmetic is varicose vein example, famous example. You would understand from the word itself, curative, diagnostics, cosmetic. Okay. Now all this were the classification. Now next is a important one which every student should know. Groups of surgical instrument. Now there are two, general instrument and special instrument. Now general instrument, there are three: for dissection of the tissue, for homeostasis, and for fixation of the tissue. For dissection, for homeostasis, and for fixation of the tissue. Now this you should read, you should memorize. What are the structures, what are the instruments, what are the names of that instrument, for what it is used. We should keep seeing the image, we should keep memorizing it, then only it would be in our mind. And next is for connective tissue. This is general instrument. Now next would be the special instrument. In the special instrument also there is a category called needle holder. So please go through the structures and its names, so it would be helpful in the future or whenever you would go through or handle these instruments. Now last topic is the separation and connection of the tissue. Okay, we did the operation, we cut the skin, but how we should join it? Separation and connection of the tissue. Now there are types of knot. Whenever you would study the surgery in real, you would learn it. There are different types of knots, but here we would learn types of knots: double surgical knot, simple knot, and nautical knot. These are the three types: double surgical knot, simple knot, and nautical knot. Okay. Now types of separations. Types of separations are what? With bleed and without bleed. Again, with bleed and without bleed. Now what does mean with bleed? With bleed, it is done by sharp method. Sharp method by using scalpel. And blunt method. Blunt method is used forceps or blunt end of scalpel. Okay. And without bleeding is laser. Laser and electrocoagulation. Okay. Laser, we know it is common for us to listen, to see. That's why it is not an issue to remember. There are two types of separations: with bleed, without bleed. In with bleed, there are two types: sharp method, blunt method. Sharp method, scalpel is used; blunt method, forceps or blunt end of scalpel is used. And without bleed, laser or electrocoagulation is used. Now types of connection. How do we connect it? Stitching, stapling, screwing, and by medical glue. This first is stitching. See how the skin is joined, how it is stitched. Second is stapling. The staples are used. This is nowadays common because it is very not common, but majority conditions, if it is available or it is used, then it is applied. The third is screwing, and the fourth is by medical glue. Now this stitching material which is used, it is absorbable and non-absorbable. Now this absorbable material includes the natural, like catgut sutures, synthetic sutures, and which is used in subcutaneous tissue, mucus of intestine. But there is a disadvantage of this stitching: allergic reaction. Allergic reaction may be caused. And about absorbable, okay. Non-absorbed metal includes silk sutures. Now this, it is called encapsulation. Okay. In non-absorbable material, just remember the silk sutures are used, which is also called as encapsulation. The stapling method, it is made up of tantal. Okay. Just remember tantal, which does not cause any allergic reactions, and they are mainly used in bones. And screwing is generally used in the orthopedic surgeries to connect the bones. So till here all the topic basic is covered. Okay, till now I just go through the subtopics what we studied. Okay, still now we did topographical anatomy, what it is, the terminology of the topographical anatomy, which is holotype, holotopy, syntopy, skeletopy. This was the terminology. Next is method of research, which is common very on live subject, on cadavers. Next is different form. What were the two form? Brachiomorphic build, dochleomorphic build. Brachiomorphic and dochleomorphic build, it is differentiated from the position of the cecum. Brachiomorphic, it is high position from the cecum, and dochleomorphic, it is low position. Operative surgeries, there are 3 stages. Surgical operation, there are 3 stages, as we see in the video. And next would be the terminology of operations like amputation, anastomy, centesis, ectomy, plexy. And next would be classification of the surgical operations by duration, by recovery, by stages, appearance of blood is there or not, by size, aim. Instruments, we need to go through it multiple times, then would we would remember. But more usually it is important if we handle it, then only it is easy to memorize. But for exam point of view, we need to do this. And the last one is the separation and connection, as we studied just now. So thank you for watching this video, and I hope you learned something productive. I would keep continuing this series of topoanatomy and all other subjects also. So please follow, study. Thank you.